We often think that our health will automatically be fine if there are no obvious symptoms. But did you know that your heart may be silently suffering from serious issues without you even knowing? To maintain heart health, it's extremely important to identify early signs. If you experience any of these symptoms, don't hesitate. These could be signs of arterial blockage. Before we begin, don't forget to like and subscribe to the channel. For more useful information to protect your health and that of your loved ones. Let's dive in. Chest pain is the most common sign that many people often experience and is also a concerning symptom for heart health. The pain can occur suddenly or gradually, lasting for several minutes, and sometimes it may subside when you rest. However, if the pain persists or recurs frequently, you need to seriously consider seeking medical attention. Some people describe chest pain as a sensation of tightness, as if something heavy is pressing on the chest area. Sometimes, the pain may radiate to the shoulder, neck, back, or even down the left arm. Chest pain is a symptom of insufficient blood flow to the heart when the arteries become blocked or narrowed. This happens when cholesterol plaques or blood clots accumulate in the arteries, obstructing blood flow to the heart muscle. When the heart does not receive enough oxygen and nutrients, the heart cells begin to cry out, causing the pain. Shortness of breath can occur when you engage in heavy activities, such as lifting heavy objects, climbing stairs, or working outdoors in hot weather. However, when you experience shortness of breath even at rest or during light tasks, it is a clear sign that your body is facing cardiovascular issues. When the arteries are blocked, the organs in the body do not receive enough oxygen, leading to shortness of breath, sometimes to the point where you feel you can't breathe deeply enough. Shortness of breath occurs when the heart cannot pump enough blood and oxygen to the body parts. When the arteries are blocked, the organs in the body do not receive enough oxygen. The lungs and heart require a large amount of oxygen to function normally. Without it, you will feel short of breath, fatigued, and possibly lightheaded. An important symptom that many people overlook is shortness of breath that occurs at night. If you wake up in the middle of the night feeling short of breath or have to sit up to breathe more easily, this may be a sign of heart failure, a condition related to coronary artery disease. When the heart cannot pump blood effectively, blood accumulates in the lungs, causing difficulty breathing, especially when lying down. Fatigue is the feeling of being drained, with no energy to perform daily tasks. This is a common sign of arterial blockage because when blood cannot flow properly to body parts, you will feel exhausted. The heart has to work harder to pump blood through blocked arteries, causing the body to become fatigued and lacking vitality. When the arteries are blocked, the body does not receive enough oxygen and nutrients. This forces the heart to work harder to compensate for the deficiency, which in turn causes you to feel exhausted. Fatigue can last for an extended period and cannot be easily explained by external factors such as work or sleep. Fatigue is not a specific symptom of arterial disease, but if combined with other signs like chest pain or shortness of breath, you should seek cardiovascular checkups immediately. Fatigue can occur at any time of day, from the early morning when you wake up until the end of the workday. Some people may feel drained even without doing much work. As the arterial disease progresses, you will feel more exhausted and unable to maintain energy for work or physical activities. Leg pain is a common symptom of peripheral artery disease, PAD, where the arteries supplying blood to the legs become blocked. These symptoms usually start as aching when walking or climbing stairs, especially when you have to move for a long time or exert yourself. The legs do not receive enough oxygen and nutrients, causing numbness, pain, or a heavy feeling. This symptom may subside when you stop moving, but will recur if you continue to exert yourself. When the arteries are severely blocked, you may feel pain even at rest or while sleeping. The pain may appear in the calves, thighs, or feet. If you feel discomfort or numbness in your legs that is unusual and not due to regular fatigue, this could be a sign of PAD, and you should seek medical attention for examination and treatment. When the arteries supplying blood to the legs are blocked, blood circulation is disrupted. This reduces the flow of oxygen and nutrients to the tissues and organs in the legs. The leg muscle cells begin to starve, leading to aching sensations. This is a form of peripheral artery disease, a chronic illness that can lead to serious complications if not treated promptly. Leg pain can also be accompanied by cold feet, pale skin. These symptoms will worsen over time if the disease is not diagnosed and treated early. Sudden nausea and sweating can be a sign of an impending heart attack or an advancing cardiovascular disease. When the arteries are blocked and blood cannot flow properly to the heart, the organs lack oxygen, causing nausea. In addition, oxygen deficiency can cause the body to react by sweating excessively, even when you are not engaging in physical activity. Sweating is often a sign of a serious issue occurring inside the body. When you feel nauseous along with sweating, especially with symptoms like chest pain or shortness of breath, it may be a warning signal of an impending heart attack. In this situation, you need to seek medical help immediately, as prompt treatment can save your life and reduce dangerous complications. When the body does not receive enough oxygen, vital organs such as the heart and brain begin to react. The brain, when sensing oxygen deficiency, may signal nausea as a way to reduce stress for the body. Sudden sweating occurs when the body attempts to adjust its temperature and internal pressure due to the lack of oxygen. These signs often occur simultaneously with other symptoms like chest pain, shortness of breath, and fatigue. If you experience this without a clear reason, see a doctor promptly for examination. Heart palpitations, or irregular heartbeats, are a common symptom of heart disease. This sensation occurs when the heart's rhythm becomes unstable, either faster or slower than usual, or even involves strong, irregular beats. When the arteries are blocked, the heart does not receive enough oxygen, causing it to work harder to maintain blood circulation. As a result, the heart may beat irregularly, leading to feelings of anxiety, restlessness, or the sensation of your heart pounding in your chest. Heart palpitations may be a sign of several heart issues, including coronary artery disease, heart attack, or heart failure. Palpitations may occur suddenly and last for several minutes or hours. If this condition recurs frequently, you need to get checked and treated early to avoid serious complications. Heart palpitations occur when the heart does not receive enough oxygen and nutrients, causing the heart muscle cells to begin functioning asynchronously. When this happens, the heart may beat hard, irregularly, or out of rhythm. This increases the risk of stroke, heart failure, and other serious problems if not treated promptly. High blood pressure, or hypertension, is a condition where the blood pressure in the arteries remains high, putting extra pressure on the blood vessel walls. When high blood pressure persists over time, it gradually damages the arteries, making them stiff and more prone to blockage. This leads to reduced blood flow and causes issues such as coronary artery disease, stroke, and heart failure. High blood pressure does not have clear symptoms, so many people do not realize they have it until serious health problems occur. This makes high blood pressure a silent killer, silently damaging the body without any obvious warning signs. Regular blood pressure checks are the only way to detect high blood pressure and manage it. Lifestyle changes such as weight loss, regular exercise, a low-salt diet, and stress reduction can help lower blood pressure and protect heart health. Swollen legs are a common symptom of heart failure and peripheral artery disease, PAD. When the heart cannot pump enough blood to the lower limbs, blood accumulates in the legs, causing swelling. When this condition persists, the swelling worsens, especially when standing or moving for long periods. Initially, the swelling may be mild and painless, but if untreated, it can lead to issues like leg ulcers, infections, and even the need for amputation. Leg swelling can be a serious sign and a signal of cardiovascular weakness. If you notice this condition, see a doctor as soon as possible for diagnosis and timely treatment. Skin that becomes pale, ashen, or has temperature changes could be a sign of artery blockage. When the arteries are blocked, blood and oxygen circulation to distant body parts, especially the hands and feet, is disrupted. This can cause noticeable changes in skin temperature, especially in the extremities. When the arteries cannot provide enough blood and oxygen to the extremities, the body compensates by reducing circulation to distant areas. This can cause noticeable changes in skin temperature, especially in the extremities. If you notice a part of your body with a noticeable color change without an obvious reason, this could be a sign of arterial blockage, and you need to see a doctor for medical attention. Dizziness or a fainting feeling is a sign of inadequate blood supply to the brain. When arteries are blocked, blood cannot effectively circulate to the brain, causing oxygen deficiency, which leads to dizziness or fainting. Dizziness can come on suddenly, making you feel off balance, have blurred vision, or even collapse. In some cases, dizziness may last for seconds or minutes and then subside. However, if this condition persists or recurs frequently, you should be cautious and get your health checked immediately. Recognizing the early signs of arterial blockage is crucial for protecting heart health and preventing serious complications such as stroke, heart attack, heart failure, or even amputation. For those with risk factors or warning signs, visiting a doctor and getting a cardiovascular checkup is essential. Don't wait until it's too late. Get your heart health checked today. Don't forget to like and subscribe to the channel for more valuable information to help you maintain heart health. Share this video so everyone can raise awareness about the importance of heart health.